to read to you a letter that we have received from Uachtaráin na hÉireann, President of Ireland. May I extend my warmest congratulations to all those who are involved in Polio Survivors Ireland on the occasion of the 30th anniversary since the establishment of the organisation. Tras Lom Live. The outstanding work you have done over the past 3 decades, serving the people of Ireland with kindness, compassion and dignity, is a testament to the strength of your organisation and to the remarkable individuals who make up your team. By providing advice, support and practical services such as wheelchairs, physical therapy and heating grants, your tireless efforts have made a significant impact in helping to improve the lives of those who sadly bear the effects of polio's legacy in Ireland. Your dedication, professionalism and hard work are proof of all the power of community and the importance of supporting one another through challenging times and demonstrating commitment to improving the lives of those in our society. May I express my sincere gratitude and admiration to all those involved in Polio Survivors Ireland, and may I send my best wishes to you all as you mark your 30th anniversary. Guillaume Gach Ra or Dun Toki, Michael D. Higgins, Uachtaráin na hÉireann. Thank you. I would like for us to pause for a moment to remember our deceased members who died over the last 12 months and those whose names were notified to us may have died somewhat earlier with the pandemic and one thing and another, and that the office has just received notifications of that in the recent past. So if we pause for one moment, please do that. Now I would very much like, it's my great pleasure to introduce Professor Frans Nollet to give the Joan Memorial Address. This is the second time that we were doing the address. We launched it last year. Frans Nollet is a professor and chair of the Department of Rehabilitation Medicine in the Academic Medical Center, the University of Amsterdam. And he has, they concentrate on neurological muscular diseases with particular, and his particular focus has been on post-polio syndrome. So Professor Nollet knows more, has met over his career more polio patients, I'm sure, than he cares to remember. I met him last year for the first time when I attended the European Polio Union. And it occurred to me then, as I know that many of you feel that a lot of the medical profession here in Ireland know very little about polio and post-polio syndrome. So I thought it would be wonderful if a professor of his standing would come to Ireland and address our organisation, and that you can hear from somebody who really understands where we are all at. And so it is with great pleasure that and delight that I had when he kindly accepted the invitation to attend with us today. And so now I leave the presentation over to Professor Nollet. Thank you.
Thank you, Macrina, and your organization for inviting me here to talk about, you asked me to talk about aging with polio. So I prepared a speech, and it's of course a great pleasure here to come to Ireland, which is very beautiful. And yes, I was given 25 minutes for the speech and for questions, so I will try to stick to that, and otherwise please start to wave. Okay, so I will talk about this topic, aging with polio. There are many topics you can talk about, but I think this is relevant, and as everybody is getting older, you can't stop it, you can't prevent it, and I don't want to make you feel depressed but we all know that with aging some things become more difficult, and of course we become wiser as we get older, but physically we are different from when we were 20, just for comparison. Okay, can you see? I can see my slides, but not there. It's not there. Oh, now it is. Okay, yeah. So the main question, of course, is when you get older, with your polio residuals and maybe your post-polio syndrome, how can you stay in the best condition possible? And what can be done about it? What can you do about it? And I was thinking about what is an important message that I want to leave you with. And I think the most important is that knowing people with polio, they're not complainers and they are trying to solve the problems themselves. But I think it's important that if you experience difficulties or complaints, that you don't hesitate to seek medical help for that. I think that's the most important, I would say, that you remember from this story. Now, the first thing with aging is that we know that muscle function in polio declines. And we know that in post-polio syndrome, we did a study in which we followed patients for 10 years. And we had a very precise defined group. They all had in their quadriceps muscle, they were symptomatic. And we did very extensive measurements of muscle strength and of motor units, which are the organization unit of the motor neuron together with a number of muscle fibers. And as you probably know, these are enlarged, which happened during the recovery after the acute polio. And we saw that this muscle strength declined about 1.5% per year. But also we saw a steeper decline in those who had the largest compensation. So that were the people who were affected the most, but recovered relatively the most. And they went down a bit more. And 1.5% a year may not seem a lot, but if you take it over 20 years, it is considerable. And also if you realize that your strength at the beginning is certainly not normal, so you have not fully recovered, and then you're starting to lose due to post-polio syndrome from the age of 40 around. So at a certain point, you really get this consequences that walking or using your arm may become more problematic. There was another study in Sweden, which was done not so long ago, and they said, well, we see little decline. So it is not going fast, but because of the long duration, it has effects. And the older you get, the more it adds. And also walking, which was measured in these studies, declined to a certain extent as a consequence, of course. So that's the first thing that we know, that in polio muscles, more in post-polio syndrome, that there is a decline in muscle function over time. But also aging itself, especially after the age of 60, has effects on muscle function. And the main thing which is happening at older age is sarcopenia, the loss of muscle tissue. This is not related to polio, but it adds to it. And there are a number of factors that play a role, of course, inactivity. And if you realize that your polio muscles show a lot of compensation, inactivity is even worse in that case, you could say. So inactivity, but also nutrition is a very important aspect where you talk about your protein intake or your vitamins. And there are some hormonal changes also which negatively affect muscle function, like lower testosterone or estrogen levels, and also that your insulin resistance develops at older age, which negatively affects muscle function. So that adds on to the aging effects due to the polio itself. And that, of course, further increases the risk of falling, for instance. And then, yeah, that's why I said I don't want to make a depressive story, but it's not, I see all very serious faces. So I try to make some jokes, but never know if it works. But osteoarthritis is much more common in polio. And that's because joints are often less developed, especially in the affected extremities. And there's an asymmetric or an increased load on these joints for many years, which contributes to a more frequently development of osteoarthritis. And it's important also to realize that hip and knee prostheses, for instance, are possible, even in weak legs. Sometimes you have to make custom-made prostheses, but we work very closely with orthopedic surgeons. And that's, of course, really highly specialized care where you really have to think you don't only have to think about the X-ray you're looking at, but you have to think about the person. How is he or she functioning? What is he or she doing? And what therapy should be given after surgery or even before to get the best outcome. So, and I think that's important. If you have pain, that you have it examined quite well, because not everything is post-polio syndrome. What you hear sometimes is that people come to us and they said, yeah, they said it's post-polio. And then we look at it more carefully and then we see that there is really a joint problem. And of course, if you have pain from a joint, that will negatively affect your functional abilities. And if you then treat that well, then you see an improvement. So it is important to look at that very carefully. And here, for instance, this is a type of prosthesis that you may use in a weak leg. This is a knee prosthesis, and it's a constrained prosthesis. And what it has is that it has a hinge in it, and that gives more stability. And for instance, people who walk with their knee in a lot of hyperextension, so you can limit that movement with these types of prostheses, and they really have very good results. But this has to be done by experienced surgeons, of course. And also, what we see a lot is severe degeneration of shoulders, for instance, or elbows, especially in people who've been using their arms instead of their legs all the time for many years. That can be walking with crutches, but it's also the transfer from sit to standing, where you're always using your arms, or when you sit and you have to support with your arms to sit stable, that can give these results. And we really have quite a number of patients who have these severe shoulder problems. And that's really difficult to treat because we are very reluctant with shoulder prosthesis. The outcome is less predictable. So here the main approach is that you try to take out the high loads in all the daily activities. And this is really not rare, but quite common, unfortunately. And then, besides the osteoarthritis, you also have the osteoporosis, which may develop. And it's more common among polio survivors. There are two quite recent studies from Taiwan and India, and they really show that this is more prevalent. And that, of course, also raises the risk of fractures when you fall. So it's important to do these measurements and to start medication if there is osteoporosis. But medication itself, like vitamin D and calcium biphosphonate, is not in itself enough. You really also have to look at ways that you still load the bone tissue to get the best result. So weight-bearing exercises in some form are very important. So this is also a risk. And that means that there is really a very unhappy combination of different factors. That is the increase in muscle weakness, but also when you get older, your skills get a little less. So balance may become more problematic. Your bones become more vulnerable. On the one hand, the osteoporosis, but also the elasticity of the bones decreases. So that means that there's a really increased risk of fractures. And I don't know if there are many people here who have been at fractures, but we see it a lot. Here are a few examples where orthopedic surgeons had a good amount of work to do. And it was also that once you had a fracture and then you are treated, either or not by surgery, the recovery is also more difficult. It's slower, there may be a delayed healing of fractures, and that of course negatively affects your muscle function again because of the period of immobility. So the main message here is be careful and try to prevent these fractures, but it can happen, of course. So that's also a negative combination, which makes it quite difficult. And then, as we get older, there are also, whether or not lifestyle-related chronic diseases, like diabetes or cardiovascular diseases, maybe weight gain, also in combination with reduced activity where you need less calories. So this again also may add to the risk of falling and also less activity. So at this moment we have just started up a study where we want to get a more clear, get more knowledge about how much energy what is your energy expenditure during your daily life, and what is your nutritional need. Because all the advices are based on average people without any problems, and what we know that many polio survivors, they use much more energy, for instance, when walking, because it's more difficult. So you can have an energy use which is more than twice of normal values with walking. So that's sort of a good news also, because it means that you are always training yourself. So that's a positive point. So we're doing a study now to get more insight in it. And the next thing are, of course, the psychological aspects of aging with polio. You constantly have to adapt to your declining functioning, and maybe you're less able to participate in the activities that you want to do. So we also give a lot of attention to psychological support, for which we developed an intervention program, a cognitive behavioral therapy, which tries to influence how you think about things. I have patients who are very, very active because they are afraid that otherwise they will lose their muscle function, but they are constantly overloading themselves. And on the other hand, I have patients who do almost nothing, but because they are afraid it's not good for their muscles. So you have to look at that at an individual basis. And so we developed a polio-specific program together with our psychologist. And very important is that you don't only discuss why are you doing it this way, and learn to think in another direction, but also that you start with the things that come prior to it. And the first thing that is very important, that there's room for mourning, because people really, it has a great emotional impact when you experience that you're declining in your functioning. And also, as you all know, many of you have learned, especially not to complain, not to ask for help, but to solve it yourself. And then when things become more difficult, you have to change that because you sometimes need to ask for help, or it becomes visible that things are getting more difficult. So there's this mourning, there's what we call coming out, that you have to show it, that you cannot hide it anymore to in your family, your friends, or your work. And then we start the change behavior interventions only then. And at this moment, we are running a study where we have made this intervention partly that you can do it from home through the internet. You can do your exercises, your homework, so to say, and you have some meetings with the psychologist to monitor the progress and to start and to conclude this intervention. And we didn't get money to do this study because it's quite difficult to get funding for studies in polio, because every funding body says polio is a thing of the past. Yeah, maybe the disease has more or less disappeared, but there are all these people who had polio and they're still needing, having problems and need treatment and need research. So we started this and we did a fundraising with the patient organization, which you can see some pictures on there. So it was very successful, and that way we funded this study. So talking about all these effects on muscles, on bones, on your joints, on your minds, it's important that you try to do things to maintain your functioning, and you can do quite a lot. You can do exercises that target your cardiorespiratory condition. You can do strengthening exercises within your possibilities, of course. And of course, also important to do weight-bearing exercises. And this, I think is best when you have a good physiotherapy practice, which is well informed. So we're setting up a network in the Netherlands for practices who are really interested in treating people with muscle diseases. And that you do that and see it also as a thing you have to do to keep in shape. Of course, very important to avoid overweight, and also the other side, undernutrition, which is also no good, and that you take care of your nutrition. And very important, see your rehabilitation doctor, and if needed, your team regularly when you have problems. So I have a few more minutes. Yeah.
Yes, you have.
Yeah. Okay. And just to say a little about what we do in our expert center, it was established in 2010 formally, but we started already in the late 80s. I think the first polio patients I saw was in 88, so 35 years ago, which is a bit longer than you exist. And but it started, then it was rather new, and well, from one thing came another, so we became the center for the Netherlands, and yeah, never stopped that working in that area. It is the post-polio center is led by the rehabilitation medicine department. We need a neurologist, of course, in case of diagnosis, and especially to exclude other conditions. And we see quite a number of patients, and also a lot of patients who contracted polio outside Europe, where polio lasted much longer. What we don't take people in the clinic, it's all outpatient services. And of course, the first step is to do a thorough examination to see what's really going on. So we normally do, as a standard procedure, X-rays of joints we do imaging of muscles to see also how good the good muscles are and how bad the bad muscles are. So you get a full picture. And then we have several therapy options, like what is maybe interesting for you is that we have a one-day multidisciplinary rehabilitation team evaluation. We do a lot of in orthotic devices, and of course we treat people from which don't live too far from our hospital for outpatient treatment. But and what our starting point is that we really try to do a patient-centered care. So we start with the things that, the problems that people encounter and the questions they have, and how we can help them with that. It's very popular at this moment, the topic of shared decision making, but I think it's not talking about decisions, it's talking about goals and plans, and from that, what you're going to do. So it starts earlier than only decisions. It is, what direction do we want to go? And of course, how can we help you to continue your participation in the society, your independency in daily functioning? How can we reduce your symptoms and also preserve for the future? Yeah, almost. So this is maybe, I think this is very, very much appreciated by our patients. They come from all over the Netherlands, and if you, at the end of your consultation, as a doctor says, you should do this and this, then people don't know what exactly they should do. So then we thought, how can we do this better? And we developed this one-day team evaluation where people are seen for an hour by a physical therapist, by an occupational therapist, a social worker, and or a psychologist, the doctor, and then at the end, the whole team together with the patient come sit together and make the conclusion and also decide what further direction to go. And it is very, people really appreciate it, and also it is very good for your team cooperation as well. So that is the way it works. And also afterwards you get a letter, and the letter is sent to you, and the copy goes to your general practitioner, because it was you who is coming to this day with your questions that you want answers for. So that's a way of working that we really like very much, and I think it's very good. Well, I think that is the final slide. Yeah. Here's some research projects and topics we're doing, but that's not really relevant. Okay.
Anybody got any questions that they would like to ask Professor? Yes. The lady here. Please remember to give your name first.
Charity. How much would that how much would be required to set that in Ireland? Because this multidisciplinary rehabilitation team, that sounds brilliant. And I think that would go a long way to help solve a lot of problems for a lot of people.
Yeah.
So how do you set that up?
Yeah, I think we started it, I have to calculate a little, I think some 25 years ago already. And after you make the conclusion at the end of the day, what should be done, then we also discuss which way is the best to organize it. So then we contact the local physios and we give them, our therapists, inform them what the best to do for this individual. And so we also trying to do that in network settings and together with primary care providers.
Thank you. Anybody else?
Yes.
My name is Alan Shanahan, and I think that's been an absolutely wonderful talk, and I thank you very much. Very informative. My question has already almost been mentioned here at this table. I want to know, could I go across to the Netherlands for a day and go on your program?
Yes, we sometimes see people from abroad, and then, well, there are two things. The first is, if I don't know somebody, the first thing I want to do is a good examination. So there's two parts. And the second is the day program. And if you want to combine it, then we always have to see how we organize it. But we see often people coming, especially also to have a good diagnosis and a good assessment. But things are possible, yeah. But of course, the capacity is of course limited in a certain way, yeah.
Could we look into this and into the costs involved and whether we as a group, 4 or 5 of us could go across? What's going on? How would we organize this? It might come in cost, and I would be extremely interested in the sooner we do. I fall into all the categories you said there, but I like also was here. I am very positive, and I want to stay as well as I can for as long as I can. What I could do with a lot of help right now between just diagnosis and maybe aids and appliances, my appliances could be different, and I would appreciate a phone call.
Yes, well, thank you that you're so positive, of course, about it. But I think the optimal situation is that you could create something here in Ireland where there is a joint team that can look at you from different perspectives, and that it's comes together in a plan that is coordinated and that everybody is working on the same topics. That would, of course, be the best. Yeah, yeah.
Question over here.
Hello, my name is Liam Porter, and now this is a general question. I'm not asking for a specific answer to this because that would be unfair on you because you have to see the patient. So, in a general way, do polio survivors get pain in the hip area and thigh area, especially in the leg that was worst affected by polio? Now, again, I only expect a general answer because I know you cannot give a specific answer.
Your question is whether polio survivors get pain in the hip region of the affected leg, or?
Yes,
okay.
Of the affected leg and the hip region and the thigh region, yeah.
Yeah, well, I think if you have pain in your leg or in your hip region, you really have to differentiate what the cause is. And there can be many different reasons. One could be...
Now, they have searched for a reason as to why the pain is there, and they cannot find the reason, and they've searched for the reason over quite a number of years. So it would seem to point to a post-polio problem. And is that something that you have come across because they cannot find a reason?
Well, there always is a reason in general. Or there are things you have to consider. One is that, for instance, a joint may be less developed and it may have less stability. Then it can be that, for instance, due to certain movements, like a transfer or whatever, that there is an irritation of the capsule of the joint which can give pain. And there's not necessarily then osteoarthritis. So the X-ray may seem normal, but it still can be from the hip joint. It can also be from the muscles, which are weak and which are overloaded. It can come from the back. So you have to, it can come from walking. If you, the collision of your foot with the ground is very abrupt. So you have to see it not only from the pure medical perspective, is there a hernia or is there a hip joint degeneration, but also from the functional perspective, from moving and how you load your joints or your muscles. So I think that's very important. I had patients who walk because of their instability with their trunk forward. They have pain in the back, and they're sent by the neurologist to the anesthesiologist, and they give an injection of the back. But if you improve the stability of the leg and they have to walk, are able to walk more straight upward, the pain disappears. So, and that's why you have to work and to see patients with different specialties in close collaboration, and not only from the perspective of that specific knowledge area where you want to see what you're used to look at. So maybe it's a bit long answer, but what you need is to really puzzle and try to understand what the complaints cause.
We could take 2 more questions now.
My name is Mary Brady. Professor, thank you for your talk. I just want to discuss symptom management of pain. I have polio, I have paralysis in the left foot, so I'm inclined to walk out on the side of the foot. But of late, I started feeling like a stabbing type pain, which was very kind of aggressive on the front of the foot. And I was wondering, is that like, what do you think of that? Is it to do with the way I'm walking on, on the foot, or is it kind of maybe nerve damage? I was just wondering about that.
Yeah, that's also, of course, difficult to say, but there are a number of causes that you have to look at and exclude whether or not it is something with the joints in the foot or the nerves or the bone. It can also be. And then, of course, how well is the foot supported? What is the quality of the shoes, and so on. So, yeah, it can be different reasons.
Last question.
Okay. Thanks very much for a very knowledgeable and informative talk, Professor. You've covered a lot of the factors which I tend to be scared of myself because I feel them literally impacting on me at the moment. But the one question I would like to ask you, I mean, for example, as far as I'm aware, we have no centre in Ireland for dealing with specific polio complaints. And there's a total lack of knowledge with Irish medical professionals on the after effects of polio, undoubtedly. Now, before I ask you the question, I just want to make a few comments. For example, my previous doctor, who is now retired, I was her only polio survivor as a patient. My present doctor, I'm the only polio survivor as a patient also. So I feel it'd be totally a waste of time trying to, or asking him about possible polio problems. Secondly, when I actually, I had a knee replacement, a standard knee replacement on what I call my good leg, not the polio leg. I suffer from polio in my right leg. So I had a standard knee replacement last year. In the hospital, which was a renowned polio hospital years ago, Kappa Hospital, I asked young nurses in the 3rd year of the 4 years in college if they had heard about it. They had never heard of polio. They don't cover polio in their lectures, etc. Therefore, they know nothing whatsoever about it. So my experience of our medical profession is they're literally fascinated by me, and they were using me literally as a case study in the hospital. Now, so my question to you is, what are the essential requirements you'd recommend to establish a centre in Ireland? But I know the problems we're going to have immediately from the Department of Health and all the government departments. We haven't got the finance and all the rest. But we're supposed to have billions of surplus in our budget, billions this year. So I'd just actually like to know, what are the essential ingredients to set up such a centre in Ireland? The minimum ingredients.
Yeah. Yes, well, that's from the one hand an easy question to answer, but also a difficult one, because my first question would be whether or not there are rehabilitation services that are specifically focusing on neuromuscular diseases, or that it's not organized like that. In the Netherlands, we have rehabilitation centers which are approved by the patient union. There's a patient union for muscle diseases, and post-polio is a subgroup, which on the one hand is a disadvantage for your visibility. On the other hand, you're covered by a much larger organization. But then there are these centers which are approved if they have the certain requirements that is staff, but also so the different areas that you need, like physiotherapy, or occupational therapy, well, everything, speech therapy, or depending on. And then you also have to see a certain number of patients to get this approval, and they have to have therapy protocols that they are able to show. So that is the formal side to approve a center. But what you really need is that you have people who are really willing to do it, and somebody who's taking the lead in it. And I think, I don't know how rehabilitation medicine is organized here in Ireland, but when I started to see the polio patients, it was a disease that was sort of owned by the neurologist. We are the one who can say who you had polio and whether or not you had post-polio. And what I learned from treating patients is that the first discussion is not whether or not you have post-polio syndrome, but what are your complaints and what is causing it. And if you have difficulty because your joints are getting problematic, it has a functional impact also. So, and we can, and it's easier from rehabilitation medicine, which focuses on the functional consequences of diseases, that you try to connect with all your colleagues from other fields to bring together that expertise. But in other countries, there is among neurologists more rehabilitation oriented. So, but you have to have somebody who is willing to pick it up and to bring together such a team. I think that's the essential.
There's just one question from Zoom. It's whether anesthetics have an effect on mobility.
Whether anesthetics have an effect on mobility? Well, if it's anesthetic that you get for a narcosis, then your mobility is temporarily not possible, of course, but certain painkillers, or I guess.
Thanks, Macrina. Thank you very much, Professor Nollet, for your excellent Joan Bradley Memorial Address. I think you probably got the sense from the questions, the sentiment in the room. I think we found it very, very useful. I think you said at the start that aging is something we all have to face into. I suppose sometimes we try to ignore it, but it is something, I suppose, it's better to be forearmed and forewarned. So I really want to thank you for, I think, a very informative and engaging presentation. I think you gave us a lot of facts and insights and information on prevention and then intervention. And you rightly said that polio survivors are independent, positive and resilient people, and sometimes try to maybe solve the problems themselves. But you rightly said as well that with any of us, it's important that people seek support and help in dealing with I suppose, the effects of aging. I think you gave some very good advice and guidance as well in relation to what we can do in terms of the whole prevention area, which is really, really helpful in terms of health and well-being. I think you gave a great overview of your centre and the work that you're doing in the Netherlands. And I think actually my colleague at my table, Mary, and I know came from the sentiments around the room, I think the sense was, wouldn't it be wonderful to have this centre in Ireland, you know, kind of a multidisciplinary kind of overview. And it is, I suppose, something which I think we as an organisation probably need to look at, you know, and I think Pat rightly mentioned resourcing will come into it, but I suppose if it's something that members need, it's something we certainly have to look at. So once again, I really do want to thank you for joining us and also for engaging in the discussion. You got some really good questions and you really engaged very well. So just on behalf of Polio Survivors Ireland, really want to thank you so much for coming to Ireland to join us. I hope you enjoy some of the nice scenery and the weather on your trip here. and for your excellent presentation and giving us lots of food for thought and for further work. And just on behalf of the Polio Survivors Ireland, it's just a small token of our appreciation for your presentation. Yeah.